the health departments are really seeing some challenges at the state level in terms of, states giving money for HIV prevention. We see, a waiting list, an ADAP waiting list, an AIDS and Drug Assistance Program waiting list. Again, ADAP is the kind of safety net for HIV positive individuals who are underinsured or uninsured. And we have a list that keeps growing that is now in the thousands. I mean, ADAP has historically always had a waiting list, but never have we seen it at this amount.
Right.
At the community level, we have communities who are facing also a different kind of a layered effect of how can we keep the day-to-day, how can we keep our doors open? And how do we have the capacity to, with this changing landscape of moving into potentially more biomedical prevention methods, are we ready for that? We've been working with behavioral focused efforts for years, and we build our organization around that, but now there's a shift kind of a paradigm, and our Latino serving organizations or these smaller organizations across the country are prepared for that.
Mm.
I mean, now when we have so many structural issues that we really need to deal with, where structural interventions may actually be more appropriate, and I don't know if we want to get into that discussion at this point, but when 32% of Latinos are uninsured, I mean, there's something to be said about the necessity of ADAP among Latinos, sure. Period. I think that the atmosphere and the kind of feeling around immigration is hostile, and I feel like it's not just happening in the U.S. Actually, this is also happening in many other Western countries where the embrace, if you will, of immigrants isn't as welcoming as it once was, where their place is much less secure. And as a result, people respond to that with a lot of fear, not necessarily knowing kind of as an undocumented person what exactly that means in terms of access to care and other social service benefits and basic things like housing. But it also means that providers are also at a miss in terms of wanting to be able to provide more services, but feeling unable to.
Or unsure of what they can provide.
Yeah, and building on that idea, Francisco, remember when we were doing the study, there was a sort of a perception amongst people who were receiving the services that they weren't sure if they were undocumented, what their relationship to these public health people should be. They're state actors, right? They're people who work for the state. What's really the difference between them and the immigration authorities, right? So in fact, they may have been in a jurisdiction where there's all kinds of access for people who are undocumented, but they don't know that. And the state health officials may think, well, this is our policy, but the community actors, the people on the ground, may feel no, they don't feel that comfortable talking to an official of the state. And so really, in one sense, it was the community-based organizations. They were the mediating factor there. They were the ones that would create sort of an environment where people felt welcomed and didn't feel threatened. And although these people received state funding, they weren't like people who were like the government in that sense. Just to go back to this whole question of same-sex marriage, right? Although, whatever your position is on it, if you're struggling, you're undocumented, and you're just looking for a job, getting married may not be the most important thing on your agenda. Sometimes
it was an issue that was in some ways irrelevant to people's need to meet more basic needs, right? So, and I think that it really has something to do with where people are and how diverse the Latino community is, really.
That's a thing that kept on coming up. I'm glad you said that, because in the focus groups you can see it, that there was a real concern around mental health issues of Latino gay men, and it doesn't necessarily just so focus on being HIV positive or being at risk. There were a lot of things. Folks who were away from their countries feeling depressed. A lot of immigrants who come to this country this first couple of years, they suffer from mental health problems, or maybe things that weren't apparent in their own country become much more apparent here because the social support network is more brittle than it was. It flowed more in their own country, right?
And this is actually related to the idea of providing comprehensive services, so that you're not just dealing particularly with HIV, but that you're also incorporating mental health services, that you're incorporating all of the different dimensions of services that are necessary for people to be able to navigate a complicated disease, but complicated lives.
One participant said, it's great, he got tested, he found his status, But it was not so much getting the HIV status, it was what happened the 5 days after or the 10 days after. He felt there was nothing for him. And I think, that's a big challenge that came out in some of our focus groups of like, it's great to do all these testing campaigns, but what support services or what support systems are in place, particularly around these young Latino MSM or gay men who are becoming infected, who are knowing their status? What services are in place for them to really make sure that they know that they're not alone, that there are these services, there are organizations that provide services for them, and then helping them navigate the system. I think, us older individuals, I think, have trouble figuring out what the system, what do you have to do. Imagine an 18-year-old whose parents may not speak English.
Yeah, and that's the question of continuity of care. How do people get into care? How do they stay in care? What are the kind of limitations they have to confront in care if they have a work schedule that's really difficult? How do they stay healthy? Or if they have to go to an appointment and they have to wait many, many hours before they see someone to get certified for, let's say, their medications, how does that present a challenge? So part of that is, one of the solutions that sounded in the focus was to have like patient navigators, to have people to help people through that process, but also to have models of care that are integrated models. So people can go to one appointment and deal with all the things they need to deal with, so it doesn't become several appointments dispersed over a week that's taking away time from other things like basic employment stuff. With people who are HIV positive, it's almost like you're in the closet again, right? And you have to figure out, how do I negotiate this new closet? And although there are obvious consequences to come in and say you're a gay person, there are a whole set of other consequences when you want to, if you share that information about HIV positive, legal, economic, family consequences. It's a really difficult.
Sometimes when the organization was strictly having to do with providing HIV prevention, care, and treatment services, that formed another level of stigma. Whereas when they merged with other organizations that were broader, their health missions were broader, or the organizational missions were broader, so that they were dealing with things like immigration or other health services, that people were actually able to go into these places essentially without having to also be burdened by the stigma of, oh, this is a place that's only for LGBT, or this is a place that's only for people who are receiving care and treatment for HIV, something like this.
With 30 years into the epidemic, the stigma has morphed into something that is really is changing as the epidemic is changing, unfortunately.
Covert.
Exactly.
And again, I think that part of it is emphasizing positive examples of having come out on these multiple fronts and still being embraced and being loved, and having the, so I think it's also about being selective about the kind of images that are available to people and more immediately accessible. Otherwise, we continue to perpetuate the idea that it's impossible to do it, and it's impossible to be loved as a result.
In particular, I remember in one Midwestern area that we did research in, there was this man who was HIV positive, had been for quite a while, and worked in the farming industry in that area. And just a simple thing that I had never, really thought about as a Latino studies scholar, as a HIV prevention scholar, I didn't realize that one of the problems of care in rural America is simply having a car, and if people are giving you rides to the HIV clinic, in one sense, you're outing yourself as having HIV positive, being HIV positive. And I think that one of the things that we recommended or thought about was that there should be transportation modes that preserve confidentiality, especially in rural America. There is an association between using alcohol excessively, using drugs, and putting yourself at risk. Well, we should ask ourselves, what is it that's leading people to do the alcohol and drugs? Why do they need to feel that high to express something of a connection between a person? And I think it's all the stuff we're talking about. Stigma, these structural inequalities, all these things that people have to negotiate on a day-to-day basis.
So as a coping strategy, people then, get high, get drunk, and it becomes part of a cycle. In one of our focus groups, there was a man who talked about crystal meth. And crystal meth in some places was totally irrelevant. He says, before crystal meth, I couldn't really deal with the fact that I was gay. And then I would do it, and I would just, you know, not only be a top because that's where I started, but then I would also bottom, and I realized I liked it too. And it was like this whole cycle around the complexities around sexuality and, you know, drugs and all these other kind of risk behaviors, but really fundamentally having to do with feeling comfortable and having, you know, what it takes to get to that point.
And that sort of also leads into sort of the question of space. One of the things that I think we found throughout our research was people want a social space where drugs and alcohol or necessarily sex are not necessarily involved, right? And this is where collaboration could be key, the community-based organizations could be key, and in spaces where people can socialize, have interactions, develop and grow as people, and it doesn't have to be focused on the party scene. Not, you know, if you want to party, that's fine, but there should be alternatives to it, right? There should be something built, and I think that's a real, you know, opportunity.
They just wanted to hang out where there isn't a beer in front of them, you know, where they're not. It's just kind of a comfortable place to meet fellow, you know, gay men, Latino gay men, to speak English, Spanish, Spanglish, just to hang out, and not necessarily also getting that drilled down effect of like, you need to do this, you need to do this, you need to do this, or you can't do that, you can't do that, you can't do that. But the challenge is, though, when we spoke to the community about that, and their observation is that because of the funding streams, they have to make sure that they meet their quota. They have to make sure that these messages are being said.
Sure.
They don't have funding streams that allow them the flexibility to be able to just to have a space to hang out. You know, because they have to make sure that this message and that message is delivered.
Yeah. Although we really did, and I was really happy to see good examples of what that might look like, right? I mean, I can think off the top of my head of at least 3 drop-in centers that were really places where Latino gay men would congregate in a real like low threshold kind of way, right? Where there wasn't a lot of the, you know, public health preach, I guess. And so I think the other part of that then is also supporting homegrown interventions and really being able to articulate what those spaces look like through evaluation and research. So a pitch and a plug for more of that so that we can actually document what people are doing in innovative ways that allow them to get these messages across in ways that don't feel so heavy.